The rapidly spreading Ebola outbreak in the Democratic Republic of Congo has become the deadliest in the country's history, with the death toll reaching 2,325. Government figures released have now confirmed that the current crisis has surpassed the 2,299 deaths recorded during the 2018-2020 outbreak. Now, the UN humanitarian chief has described the situation as the fastest growing on record, noting that the virus is killing one victim every 30 minutes. The number of confirmed cases of infected has surged to 4,945, with the case fatality ratio rising to 46%. This means that nearly 1 in every 2 confirmed patients is dying of this new strain. This is the DRC's 17th Ebola outbreak. It is driven by the Bundibugyo strain, for which there are currently no approved vaccines or specific treatments. Efforts to contain the virus are being severely hampered by weak health infrastructure. The region's remoteness and decades of conflict involving armed groups in the north and east has added to the difficulty of medical professionals. A significant hurdle is widespread public fear and misinformation. Many residents believe symptoms are caused by poisoning or other illnesses, leading them to avoid treatment centers. Consequently, more than 70% of deaths occur within the community rather than in clinical settings, as patients arrive at hospitals too late for life-saving interventions. Medical workers are also sounding alarm bells that the fear of infection is driving expectant mothers away from clinics and putting both women and newborns at greater risk.
It was really stressful because I was in a clinic near the Ebola treatment center. Even when the nurses and midwives came to see us, it sometimes traumatized me. We had also witnessed many Ebola-related deaths. I thought to myself, Lord, I don't want to risk catching this disease.
Declared on the 15th of May, the outbreak has spread from the northeastern province of Ituri to 5 other provinces. Public health officials warn that without immediate acceleration in the response, the outbreak risks approaching the scale of the 2013-2016 West African crisis, which claimed more than 11,300 lives. While global health authorities are evaluating experimental vaccines and therapies in a race against time, experts emphasize the urgent need for greater speed, scale, and solidarity to prevent the virus from further outrunning containment efforts. And there's more on this from our correspondent Louisa Olani, who has sent us this report from Lagos.
The Ebola outbreak in DRC has now become the deadliest in the country's history. More than 2,300 people have died in just 3 months, surpassing the toll of the 2018-2020 epidemic. With nearly 5,000 confirmed cases and still no approved vaccine for this strain, health workers and the UN warn the epidemic is waning. Now the real question is whether the world will respond with the speed and scale needed before it gets much worse. From Lagos, Nigeria, Louisa Olani, WION.